I am Dr. Poornima Kale, founder and mentor of RadOnc Residency App. Today I am going to tell you how this year you can transform your entire perspective, knowledge and understanding of radiation oncology subject just with the help of this one single tool. So let me give you a blueprint of what I am trying to tell you. So every year has 12 months, as we all know, and what we are going to do is we are going to divide these 12 months into 4 blocks. So we have 4 90-day blocks. In these 4 blocks, we are going to complete the entire subject of radiation oncology. Are you guys with me? This might sound a bit weird and a bit controversial, that how can I be able to complete the entire 3 years of subject in 1 year? But what if I tell you I have a hack by which you can do this? So let's deep dive into how we can start right now from January 1, 2026 to completely transform the radiation oncology journey. So starting with the topic 1 or the block 1. That is January 1 to March 31st, that is your first 90-day block. What you have to do is you have to download the RadOnc Residency App, okay, and subscribe to the app to at least module 1 for now. In the first 3 months, you have to complete just module 1. In module 1, what do you have? You have radiobiology and radiation techniques, okay. So radiobiology and radiation technique will take you around 1.5 months to complete, not more than that. But what you have to do with that is, when you are watching the lecture, you also have to sit with Eric J. Hall textbook, and once you are done learning from the app, you have to come to the textbook and correlate it, solve the MCQs and do this 2 times. What am I saying? Do this 2 times. 1.5 months for first read and first lecture reading, first notes, first MCQ solving, and do it for the second time immediately after the first read. So that is your 90 days for module 1. Then we come to another block of 90 days. So the second chunk, I want you to subscribe to at least module 2. In this we have 3 topics. So first is radiation physics, then we have brachytherapy and recent advances. So again, this will take you around 2 months to complete the first read. So how are you going to divide this? Now as you are familiarized with the app in the first 90 days, these 90 days will take it a little bit faster. So you will complete the entire physics in 20 days. So there are around 23 to 24 lectures. So you can watch 2 lectures on a Sunday and complete it within 20 days. The next 20 days will be for brachytherapy and the next 10 days for recent advances. So 20, 20 and 10, that is complete 50 days you will complete the module 2, right, which includes radiation physics, brachytherapy and recent advances. And once you are done with that, you will repeat it, okay, you will revise, revisit and repeat it in the next 40 days. So you can give 15, 15 and 10 days. So that is how you can completely revise module 1 2 times, module 2 2 times within first 6 months, right. After that, what you are going to do, you are going to deep dive into module 3. So in the third chunk, that is after 6 months of completion, we deep dive into clinical oncology. Now for the first 90 days of the second half of the year, what we are going to do, we are going to only focus on 6 important topics of clinical oncology. What are those? First is breast, second CNS, third is GU, genitourinary and prostate, then you have GI, cervix and hemat. So these are the most important 6 topics that you are going to study throughout the 90 days. So how you are going to do that? You are going to give 15 days to one topic. So 15 6 are 90. So in 15 days you are going to cover one topic. So like that you will cover these 6 topics throughout your 90 days time. So how you are going to do that? So suppose you are studying breast. Now you have to go for APBI. So APBI, you will return to the module 1 radiation techniques, study the APBI, then go back. If you are studying cervix and you come across brachytherapy, you will go to module 2, study brachytherapy in short because you have already done it very well, revise it and come back. So this is called as integration module. Then if you are studying colon and you find the drug Folfox or oxaliplatin, you will go to the chemotherapy module. In the module 3 itself, learn about those drugs and come back. So within 15 days, you are very well going to do the integrated learning of all of these 6 important sites, and for the remaining 90 days, You are going to complete the remaining topics of clinical oncology, medical statistics, general oncology and RT related effects. So you can easily do that, and in the last 15 days go for module 4, which is the practical module, which is the culmination of all of these things with history taking. So with that, what you can do is you can actually cover every single topic from the entire radiation oncology in 1 year if you do it dedicatedly. I am not joking. I have done this myself. I've made this app based on the principle of the foundation hierarchy, module 1, module 2, module 3 and module 4, and this is how you can sum it up and you can learn and revise and retain the entire radiation oncology in one single year. So I think if this does not excite you, I don't know what will. You can change your life in this year. 2026 is going to be your year. Are you ready to do the changes and make the effort?